So today we are going to begin our 4-part series on mindfulness for chronic pain. This is a big topic and very important. And when we enter something like this, it's important to keep in mind an open mind in terms of being open to certain possibilities, to certain suggestions. Maybe we will try a technique that initially you might not feel like is possible, or might feel like is difficult, or seems totally counterintuitive. And you're absolutely right. Going towards pain or directing your attention towards pain can be absolutely counterintuitive, because we have been taught to get rid of pain, to remove it as soon as we feel it, to try to alleviate it, make it go away. And we will have some techniques that try to do that, but we will also have some techniques where we might ask you to investigate it, maybe in a different quality, or in a different light, or with a different spectrum of your awareness. Surprisingly, the purpose of mindfulness of chronic pain is not to get rid of the chronic pain, but it's to increase our awareness to be able to live with it, to be able to hold it, to be able to be present with it all. The analogy that can be given for this is an analogy that I have used in the past, but it's like getting a small cup and putting a tablespoon of salt in that cup and filling it up with water and taking a drink from that cup. And your immediate sensory perception of that water would be, wow, this water is very salty. And somebody comes to you and says, oh, well, just increase the size of the vessel that the water is being held in. So I then bring you a 5-gallon container, and this comes with practice. And you get a 5-gallon container and you pour the same tablespoon of salt into that 5-gallon container. And you mix it up, and then you drink the water from that 5-gallon container. And you say to yourself, oh, I can barely taste the salt. Practicing mindfulness for chronic pain is increasing our capacity to be with the pain. It's increasing that vessel so that we can hold more, and pain is a part of what we're holding. But it's not the only thing. It's not, the vessel has expanded. So instead of our vessel being so narrowly focused, which usually happens in pain, where the only thing we may be thinking about is, oh my God, my pain, my pain, my pain, my pain, my pain. That's when our vessel is really tight, constrained. And through the practice of mindfulness, we take this and we slowly open it up. And we say, oh, can we notice it in any different way? Can we be with it in any different way? Can I be with it in any different way? And slowly, slowly, this vessel opens up and expands. And so that experience of pain now is held with a greater capacity, is held with a greater awareness. We have all used mindfulness for pain, in my opinion, to some degree, as we're growing up, as we're learning how to walk and we fall and we scrape our hands. Maybe our parents practice it on us, or if you have kids or nieces or nephews, or that you've actually practiced it on others. When you have a child, for instance, who's learning how to walk and they fall and they scrape their hands, one of the first things that we do is just see how the child perceives that experience. If the child starts to cry, right, what is one of the first things that we go and do with the child? We go and might comfort them. Maybe we go them. There's a social interaction. There's a social bond that occurs. I bet you that you have said, oh, you'll be okay. You'll be okay. You'll be safe. Instantaneously, that is one of the best mindfulness tools for pain, is to lessen the danger signal that our brain gets when it feels an unpleasant sensation. When our brain gets an unpleasant sensation, it triggers a danger signal for something that is threatening us. We go into survival mode, fight or flight mode. Our entire nervous system changes. And our blood vessels constrict and we get tense and our heart rate races and our blood pressure rises. And here you are coming as a nurturing human being to somebody else saying, you're going to be okay. Maybe you're with mommy or daddy or granny or grandpa or whatever it is. You'll be okay. Let's go inside and wash it off or take care of it. Or let me kiss the boo-boo. I heard Rachel Remen, a physician at University of California, San Francisco, say, when you kiss the boo-boo, it doesn't heal the wound, but it heals the loneliness. And imagine, right? You scrape your hands for the first time, you're learning how to walk, you feel that unpleasant sensory experience from scraping your hands, and somebody comes to you and says, you're going to be okay. You're lessening the danger signal that the brain is getting, that is evolutionarily programmed in our minds. You're going to be okay. You're going to be okay. And maybe you even rub the area. Right? Have you ever scratched or scraped your elbow, or your son or daughter or niece or nephew scraped their elbow and you go and you rub it? And you're rubbing the area. Another way of treating pain is sending the brain a different signal, sending the brain a different stimulus. In real time, you're actually activating touch receptors on the surface of your skin. The brain has to interpret, what am I interpreting? What am I interpreting? What am I interpreting? Is this pain or is this touch? Is this pain or is this touch? And you're literally scrambling the signals coming to your brain by rubbing it. I'm going to rub it. Okay. Oh, that feels better. Oh, good, because we just scrambled the signals that were going to the brain. The brain couldn't just narrow in on the pain. It was trying to figure out, is this pain or is this touch? Is this pain or is this touch? And there's somebody loving next to me saying that everything is going to be okay. So I'm decreasing the threat response. I'm decreasing the danger. I'm saying it's going to be okay, and I'm scrambling the unpleasant signals that are going to my brain with a touch, with rubbing, human contact. How beautiful is that? These are all pain modality techniques. Okay. You've all used. The next one, maybe you hold the child. Child is still crying. You hold the child. Have you ever had the experience where the child is crying and all of a sudden you see a bird flying overhead, or there's a helicopter that comes, or there's a plane that flies overhead, and what do? You look up at the bird and you go, wow, look at that bird. And what does the child do? Child's crying, right? Crying, and then all of a sudden looks at the bird. Instantaneously, the crying stops. Child looks at the bird or the plane or the helicopter. Hey, is the pain gone? No. But where is that child directing their attention? To something else. And in that moment, because children are so sort of present moment beings, in that moment, that direction is so focused on something else that crying instantaneously stops. But is the pain gone? All right. The attention is just not on it at that for that time. Plane goes away, what happens? Helicopter goes away, bird flies away. Here comes the pain. We've all had these experiences, even if we experience chronic pain. Maybe you have your dull, right? 6 out of 10, 7 out of 10 chronic pain. And you try to go to a movie and it's a very suspenseful movie. And the most suspenseful moment of that movie, your whole attention is directed towards the movie screen. And it's so intriguing. It grabs you. It grabs your entire being. And for that moment, you're not paying attention to your pain. You don't even notice that you're not sensing the pain until that moment in the movie screen is gone and a new moment comes in the movie, and all of a sudden it's like this cloud of pain that you feel coming back. Where was it? Was my pain gone for those 5 minutes that I was so enthralled in that moment, the most suspenseful moment? Or was it just that my mind was so focused on something else that it wasn't processing the signals that were unpleasant that were still coming from my back over and over and over again for that moment? And then all of a sudden it comes back. Maybe it's a phone call that you got. Your daughter or son's deciding to get married and you're so happy, or having their first child, or whatever it might be. And you're so attentive on that phone call. And then you hang up the phone, and then all of a sudden you feel this wave come back. Right? This happens to children, it happens to us. Now, let's say that child is still crying. We use other, what we call counter stimulation strategies as well. Right? Have you ever gone inside and gotten a lollipop or a popsicle on a hot day, or given them ice cream? And what happens? They sit down, their knee is still scraped, it's still bleeding. You've washed it off. You put a Band-Aid on it. The skin is still injured. And here they are eating their ice cream and they're totally fine. You're like, thank God they stopped crying. I didn't know what to do. Their focus and attention is going on the sensation of taste from the lollipop or the popsicle or the ice cream. And maybe the pain kind of comes back again and again a little bit, but then they keep on eating their ice cream. And maybe you go do something else and you play another game, and what? You ever said, oh, I forgot about my pain. Have you ever used that term? Oh, I didn't even notice it. Oh, now that you mention it, here it is. No, wait. All right. These are all pain strategies that actually have a lot to do with mindfulness, with various mindful techniques, with learning how to decrease the danger, learning how to decrease the threat that we feel, learning how to increase safety, loving kindness, compassion for yourself. You could even imagine as if you scrape yourself and somebody loving is coming, and we'll do some of these exercises throughout these 4 weeks. There's a equation that many people teach in mindfulness of pain, which is pain times resistance equals suffering. Pain times resistance equals suffering. That pain, unfortunately, or fortunately, but mostly unfortunately, is inevitable in this physical lifetime for us. I think it's believed that, 98% of people will experience pain in their life to some degree. We have over 100 million people in the United States, which is close to a third of the population living in chronic pain. Pain is inevitable, but suffering is optional. Suffering occurs when a sense of self is being threatened or challenged. When that sense of self is being threatened or challenged. By practicing mindfulness, we start to grow a greater capacity of a sense of self. We start to grow a greater capacity to hold all sensations that arise, even sensations that we consider to be unpleasant. And this is why a class like this is really good to do after learning some basic mindfulness, such as mindfulness of sensations. Because in mindfulness of sensations, we look at all sensations, right? Taste and smell and sight, touch and hearing, whatever it might be. And in today's practice, what we're going to do is we're actually going to look at specific sensation and the sensation of anything that's unpleasant in the moment. And it might be counterintuitive for you. Why am I going to focus on, isn't that just to increase the intensity? And we'll work with that. Okay. There's some great research on the effects of mindfulness and chronic pain that will, every day, we're actually going to go into some of this research. This is an article that was published in a journal called Pain Reports by Dr. Zaidan, he's in the Department of Anesthesiology at the University of California in San Diego. And the title of this article is The Neural Mechanisms of Mindfulness-Based Pain Relief, a Functional Magnetic Resonance Imaging-Based Review and Primer. So looking at the neural mechanisms of mindfulness-based pain relief. And I'm going to read some things from here for today, and then we'll go into our practice. What do they define mindfulness as? Mindfulness is defined as non-reactive awareness of the present moment experience. There's that non-reactive part. That's the non-judgmental. That's the openness and curiosity and a willingness to be with what is. Right? Non-reactive awareness of the present moment. In the context of the present review, the two primary forms of mindfulness practice are characterized as shamatha, which they call focused attention, and vipassana, or open monitoring. You may hear some of these words as you dive into mindfulness practice, like vipassana meditation. During focused attention practice, the practitioner is taught to sustain attention on an automatic and dynamic stimulus, such as breath sensations. An analogy for the qualitative aspects of the present moment. That sounds like our anchor, doesn't it? That we sustain an attention, we place our attention on something we choose to place our attention on. As the attention drifts from the object of focus, such as the breath, to a distracting sensory event, the practitioner is taught to acknowledge the event without further reaction, to disengage from the discursive event, and then to return attention to the meditative object, the breath. Samatha, or focused attention training, increases in complexity: mindfulness of breath, mindfulness of emotions, mindfulness of thoughts, as individuals develop expertise at each step. Focused attention practices aim primarily at gaining mental control and stabilization of attention. Thus, they naturally transition in a relatively undefined manner to open monitoring meditation or vipassana practice. That's that. You have your attention focused on something, and then you just sort of let it open. And next thing you know is you're simply aware. Vipassana meditation, which is that open monitoring, has been described as a state of non-appraisal and or a non-elaborative mental stance. Indeed, there is little to no concrete consensus concerning where focused attention ends and vipassana begins. Vipassana practices are associated with an awareness of the awareness of arising sensory, affective, or cognitive events. The Vipassana practitioner is said to experience each moment without evaluation or elaborative interpretation. Traditionally, focused attention is taught before or as a prerequisite to open monitoring practice. The reason for this is likely that a greater capacity for attentional stability and mental control would allow more success in alleviating one's tendency to reflectively engage with and appraise ongoing experience. As the practitioner becomes more adept in meditation, he or she will be able to use a unique cognitive approach where consciously available sensory events can be simply let go, presumably leading to significant reduction in affective or cognitive appraisals or reactions to the event. Said another way, the practitioner watches experience as it unfolds over time without cognitive elaboration or emotional reactivity. As skills in mindfulness meditation continue to develop, the practitioner brings mindfulness more effortlessly into meditation and other aspects of everyday life. It is postulated that the state transitions to a trait as a function of practice frequency and neural plasticity. All right. a lot of words. There's this quality of mindfulness practice, which I teach as well, where we start with the focused attention. What do we focus our attention on? The breath, a sensation, whatever it might be. We teach it as finding your own anchor, finding your own place that you feel as if you can place your attention, that you feel safer, more at peace, whatever that might be. As your mind wanders, you recognize that the mind has wandered, and that might take 2 seconds, 5 minutes. That does not matter. The moment you recognize the mind has wandered, you come back, and that's developing this quality of sort of focused attention and concentration. That we start there. As we continue, then, there's this natural transition into dropping that anchor and simply resting in awareness, sort of awareness of awareness. Now, what is the anchor? The anchor is simply awareness. And as anything arises in the moment, there's a non-attachment. There's a non-reactivity. It might be a thought. It might be a sensation. It might be an emotion. It might be anything that arises. It might be a conglomeration of a thought, a sensation, an emotion. Maybe it's happening so quickly in the brain that you can't, was that a thought, an emotion? I can't. It was a sensation. And as soon as I felt the sensation, I had a moment of sadness because they're so coupled. It's like they're overlapped in the neuronal circuitry. That as we practice this over and over and over again, that then there's this quality of recognizing something arises and having a non-reactivity, a non-judgment, an openness and curiosity. And I kind of like that openness and curiosity because it's like, oh, let me see if I can be open and curious, sort of like I'm investigating this for the first time. Like, let's go down this path together. Why is this important? It's important because a lot in pain management has to do with the brain's reactivity to the unpleasant sensory experience, the unpleasant sensory sensation that you are having from, let's say, the injured tissue. So there's the injured tissue, there's the injury itself. Maybe there's the osteoarthritis, the spinal stenosis, the post-operative pain, whatever it might be. And then there's the reactivity to it. There's the mental story that we tell ourselves. I'm such a bad person because I didn't lift that. I'm so weak because I didn't do that. I can't believe my body is so unhealthy that it didn't heal. Whatever it might be, whatever the story we have, we all have individual stories about, let's say, our illness, our injury, our pain. What are those stories? What are the emotions that are associated with those stories? Are there any childhood events that are associated with those emotions, with those stories? And so it's not just that sensory experience. It's the reactivity of the sensory experience that comes instantaneously. It's like we can't even separate it sometimes because it happens so quickly. It's like, oh, I injured my hand. There might be a memory or an emotion that comes up from maybe first time you injured your hand when you were 6 or 7 years old. And then what happens, your experience in that moment is all affected by your thoughts, your emotions, your sensations that are all getting mixed up, and your reactivity to the situation. So when we define pain, the definition of pain that is most used is an unpleasant sensory and emotional experience associated with potential tissue damage. We can't uncouple, when we're looking at pain, we can't uncouple the sensory from the emotion that is generated from the unpleasant sensation that we are experiencing. And then that pain as a whole is an experience. That just like every experience that we have, it comes and goes, it changes, it's very dynamic. Because we've all had those experiences. We've all had that experience of pain waxing and waning, of being less, of being more, of being aggravated, of us even not being aware of it. Okay. So a lot of the research that we're going to go into is in regards to how these mindfulness practices actually decrease and start to uncouple that reactivity, what some people call the second arrow. The first arrow that injured you, let's say you fell and scraped your knee, is the scrape on the knee. That's the first arrow. The second arrow then is all the mental reaction to that, the judging, maybe the self-deprecating, whatever it might be. That's the second arrow. With the practice of mindfulness, we can actually start to alleviate that second arrow. So what happens? We notice the sensation. We notice the sensation as an unpleasant experience. We don't get caught up in the mental stories that arise, the reactivities, and the emotions that come up, because we simply can notice them through the practice of mindfulness and allow them to be as they are and let them go. Okay. So with that, let's go into our first practice. For this practice, what we're going to do is we're actually going to pay attention to a sensation that is unpleasant if you have one in your body. And I would start, as you begin this practice, to pick a sensation that has an intensity level that is manageable. Maybe 3, 4, 5, whatever it is for you as an intensity level that you feel like is manageable. Maybe it's 6 or 7, maybe it's 8. Depends on where, what your baseline is. If you're having an acute exacerbation of pain and a massive headache, it's not the best time to do the practice on, for instance, your headache as you're having a splitting migraine, let's say. Maybe you incorporate this practice into your tools as you notice that the migraine is starting to appear, or as you notice that maybe a stress trigger came on that triggers the migraine, and therefore you do the practice. But when you do the practice and you're starting to learn it, and you're really starting to put these neuronal networks into place, that you pick something like, oh, I have a little sore in my elbow today, or my shoulder, it is achy. Those are the sorts of things that you can that I would recommend. But it's really up to you. And again, just like with any practice, if it becomes too intense, coming back to what you feel more comfortable, coming back to where you feel safe. Okay, so if you feel like the pain is increasing in intensity, maybe you move that joint, you get up, you walk, you see if you notice, you redirect your attention back to your anchor and whatnot. Okay. Okay, so let's find a comfortable position. And for this practice, you can be standing, sitting, lying down, or even walking. If you feel comfortable closing your eyes, closing your eyes. If not, having a soft downward gaze. Taking 2 or 3 deep breaths. And with each inhale, just seeing if you can relax your body ever so slightly more. And with each exhale, releasing any tension that you feel you can release. And then breathing regularly for you at whatever pace is comfortable. And directing your attention to your anchor. A place you can direct your attention to that you feel safe, more at peace. And as your mind wanders, noticing the wandering mind and bringing it back to your anchor. And this is really training the mind and body in focus and concentration. And now for this practice, finding a place in your body, if you feel comfortable doing so, that has an unpleasant sensation. Nothing that's too intense. But directing your attention to a place that has an unpleasant sensation. And notice it. Be curious about it. Instead of describing it as pain, what are the qualities of the sensation of this area? Is it burning, stabbing, aching, dull, sharp, vibrating? Simply as a sensation, can you describe it without the word pain? Does it have a texture to it? Does it have a shape? Can you draw a border? Is there a clear border, or does it sort of fade? Does it have a color? A sound associated with it? Is it stagnant or does it move? Simply being aware of the sensation with openness and curiosity. Does it change? Is it the same as it was even 30 seconds ago? Can you be with it? Say hello to it. Is it increasing or decreasing with intensity? If at any point it gets too much, simply coming back to your resource. As you're noticing this sensation, maybe breathing into it as you inhale, directing your breath to this area. Maybe asking the tissues next to it to open up the blood supply so more blood and oxygen can get to that area. Do you notice any change? Breathing into this area. Can you allow it to open and expand? Allow yourself to know that you're safe. You're not in danger. That the tissues don't need to protect you. And you can thank them for everything they've done. Purely noticing the sensation. Is it changing or staying the same? Breathing into the area with each in-breath, directing your breath as if it's bringing oxygen to that area. Ever so slightly, with your intention, allowing the tissues to open, to be less constricting. There's no more protection that needs to occur. And just noticing what happens. Now directing your attention back to your anchor. And reflecting on your sensation, that area that you chose to place your attention on. Is there any change in quality, intensity, texture, color, sound, shape? And just noticing that. Now taking 2 or 3 deep breaths. And with the in-breath, directing your breath to any part of the body that you wish. Opening your eyes if your eyes were closed. Stretching if you feel like you need to stretch. And just taking a moment to reflect on this practice of mindfulness of sensation for pain. And see how you feel.